I'm Mike Chaney, State Insurance Commissioner, and I'm running for re-election to protect the consumers of the state of Mississippi. For the last 12 years, serving as your insurance commissioner, I've been able to lower the rates in the state, keep rates stable on the Gulf Coast, and to actually improve the fire ratings throughout the state of Mississippi. As an active member of the National Association of Insurance Commissioners and a state regulator, I serve on a lot of committees and task forces that help protect consumers not only in the state of Mississippi but in these United States. I closely monitor decisions that are made in Washington, D.C. to be certain that you're not hurt as a consumer in the state of Mississippi. Since taking office, I've addressed many issues, including the accounting practice, which makes certain that companies are solvent and they can pay a valid claim, health insurance, managed care, long-term care, which is really a big problem in this nation, not just in Mississippi, but in this nation, and catastrophic and property and casualty insurance. On catastrophic insurance, we also monitor and have to regulate the State Fire Academy, which I have a director that runs that facility. We're the first people on the scene in case it's a terrorist attack or a catastrophic event, and that includes hurricanes throughout this state. And being a former business owner, I truly understand how our policies in this office affect economic development in this state. In recent months, I've taken a special interest in short-term duration policies and associated health care plans, which help lower the cost of insurance and provides the consumer another alternate route of protection in case they lose their insurance midterm during the year and they can't buy a policy in the open market. Balanced billing continues to be a problem in the United States and in Mississippi to some degree, but we've got a handle on it. The law in the state of Mississippi says that if your health care provider, whether it's a hospital or a doctor or an air ambulance, takes any part of your insurance for payment, then they cannot balance bill you for any of the remaining costs. There are a lot of rural areas in the state of Mississippi where we've had hospitals that are bankrupt. We've had 5 hospitals that have closed permanently in the state of Mississippi since 2010. We've had another 5 that have filed bankruptcy. We've been able to keep 4 of those open through working with the hospital associations and the hospitals themselves and providing more and better health insurance coverage in those rural areas of the state where these hospitals have been in trouble. It's vitally important to have quality health care in these communities, so that's one of the reasons that I stay where we are. Under the umbrella of the Mississippi State Fire Insurance Office, we have the State Fire Marshal's Office, of which I am the State Fire Marshal. And to reduce fire deaths in this state, we got a grant for 23,000 more smoke alarms that help prevent fire deaths in the state. My office answers over 13,000 emails and phone calls last year from consumers, and we recouped over $25 million in the last 10 years just for consumers. It never goes back through the legislature, it goes straight to consumers. I'm your insurance commissioner, Mike Chaney, and I'm asking for your vote again in 2019.